Hello, this is Dr. Stanley Lang, and welcome to this video. The topic is, what's the right dose of vitamin D that I should be taking, or should I be taking it at all? And the reason I wanted to share this brief video is because a close family member recently got a message from her doctor that she needed to cut way back on her vitamin D because it was too high. So when I found out what the actual result of her vitamin D level, it was not too high. It was actually perfectly in the range that I aim for, which is in the high normal range. Hers was 69. And so she was exactly where we would want it to be. Now, why did the doctor get it wrong? Well, unfortunately, many people are not trained about vitamin D at all. And that's because it's not a prescription drug, and it isn't part of medical school training, residency training, or postgraduate training in most situations. So unfortunately, there's a lot of misinformation about how much vitamin D one should take. There's actually still a debate going on as to whether we should supplement vitamin D up into the normal range. This is still part of the debate within the medical community. And if you wait for the doctors that live in the ivory towers to make up their minds on some of these things, you can wait a long time and miss the benefits of things that are so patently obvious that it doesn't require any kind of advanced additional research beyond what we already know. So the reason that you want to focus on vitamin D supplementation is not just because it's critical for healthy bones, but it's also critical for your heart to be healthy, and it plays a huge role in cancer prevention, especially breast cancer prevention in women, and prostate cancer prevention in men, and colon cancer prevention in both sexes. So it's critical to supplement in most cases because most people don't get nearly enough from exposure to sunlight, especially the part of the country that I live, which is in the Northeast. Almost everybody that I check has either low or very low vitamin D levels. So unfortunately, a lot of insurance plans no longer pay for vitamin D levels, and a lot of doctors don't want to order the levels for some patients. So you can get home vitamin D kits and get your own level checked for a modest price. And so you need to know what your number is so that you know how much D to take. How much D should you be taking? Well, my experience has been that almost everybody needs to be taking at least 5,000 units a day. I've only had 2 patients out of many, many years and hundreds of patients that I've measured levels on that had higher than normal levels at the 5,000 units a day dose. So it's very unlikely to get too high at that dose, but it's possible. So it's still a good idea to check your level occasionally. Now, some people, especially in this case, some women need to take 7,000 units to get into that high normal range. 5,000 units most of the time doesn't get you to the high normal range. And again, once you get above 5,000 units, I think you need to check your blood level occasionally just to make sure that you're not too high. Now, one of the things that's not known very well is if you're going to supplement with vitamin D, you need to supplement with vitamin K2 also. And the reason is that while the D does a whole bunch of things, one of the things it does is that it increases calcium absorption from the gut. And when it does that, it creates a new problem for people, which is all of a sudden they've got a lot more calcium than they had on hand before. And if they are deficient in vitamin K2, their body will not know where to put that calcium, and so it puts it everywhere, including the soft tissue, including your arteries. So vitamin K2 plays a lot of major roles also that I won't go into, but I will mention 3 things. Number 1, it tells your body to put calcium in the bones. Second, it says to the body, put it in the teeth. And third, it says keep the calcium out of the arteries. Now, it probably signals that same signal for all of our soft tissue because the fibroblasts that have these receptors probably have these receptors all through the body. But we don't have that research yet. We don't know for sure. But for sure, we know that it helps to protect your arteries from getting calcified by using vitamin K2 supplementation. So I always recommend to my patients to make sure they're getting enough vitamin K2. Now, technically, you can get it through your diet, but most of the K2 rich foods that are available in the United States are inconsistent in their K2 sourcing. So I have shifted in the last few years to recommending routinely vitamin K2 supplementation. And I recommend supplements that have both MK4 and MK7. That's a different story. Some people just recommend the MK7. I think the combined supplementation is better, and I encourage you to look into that more. So the long and the short of it is that this family member of mine was severely misled, and it's a travesty that more than 15 years after we've known that this is a critical issue, people are still getting really bad advice. And second of all, it's simple to do. It's a simple thing to do. It's very inexpensive, and it is a truly life-saving vitamin. So I encourage you to pay attention to vitamin D, but if you're going to take vitamin D, make sure you're getting enough vitamin K2 at the same time. So I hope you found this helpful. God bless and have a great day.